The neurology department at Poole Hospital provides services to the whole of the county. I was appointed as a consultant here. My brief was to set up an epilepsy service. The financial crisis meant that we didn't have anywhere near as much resource as we were originally promised, and that led to me starting to think about how we could change our whole process using technology to provide better care for patients with epilepsy.
We've been using the Microsoft Band with patients with epilepsy in the community, and we're using that band to track heart rate, skin conductance, movement. So we're measuring everything that's going on with the patients. Using machine learning, we know when patients are having an epileptic seizure.
If you imagine a patient who has a seizure at work and she's concerned about the possibility of having another seizure, if she goes with a wearable device and a phone, the wearable device might pick up that she is having a seizure in the device, send a GPS alert to her next of kin contacts. You could send a notification to the hospital team who are looking after her seizures, and therefore we would make changes to her care. We could provide that advice directly back to her in real time.
We're trying to help patients understand themselves better, understand how to manage their condition better, and how to best use the health service in terms of its limited resources in keeping them well, as opposed to treating them once they've fallen off the cliff and become ill.
We think that there are around 8,000 patients with active epilepsy in Dorset, and we would expect around 4,000 of those to be seizure-free. We would hope that there'd be an additional 2,000 patients that we could potentially render seizure-free using these kind of technological solutions. So it potentially turns what can be a life-altering condition into a much more manageable condition long-term.
As soon as this programme came up, I had to be part of it. The one key thing for me is about being able to have that safety net, that support system, so that I can actually regain my independence, because what tends to happen, particularly if I'm out on my own, odds are I'm going to end up in the back of an ambulance or in an A&E. I hope to get better control of my seizures and ideally to get that life back that I used to have.
I do feel excited about the idea that we could do something which meets the needs of patients to actually improve their quality of life, to make differences to their life. It makes it interesting getting out of bed in the morning.
This is a great example of a new model of care, because we've got intense patient engagement, we've got different ways of working amongst the community nursing staff and the hospital staff, and it will ultimately help patients look after themselves better.